The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning, Dr. Mencia.
Good morning, Anita. How are you today?
Well, I'm always very happy when you come here. This is lovely, lovely. We are very happy. And I always ask Dr. Mencia, okay, because we never prepare this, what do you want to talk about this morning? Because he comes like an encyclopedia here.
We're going to talk about influenza, an annual epidemic.
An annual influenza.
You know, our window looks to the north, and it looks nice, right? But when you look south, there's a huge amount of rain coming northway. So
yes.
Everybody that is on the street driving, please be careful.
Well, now, is the flu brought to us from people up north coming down here in the winter? Tell us, and airplanes.
I usually tell my patient, my local patient here, I say, come and get your influenza vaccination before the snowbirds get here. Okay. Because, a lot of my patients, they do get sick. I have a patient that I saw this week, and she travels a lot. And she said, when I was in the plane, I know there was somebody close by, not even next to her, just close by, coughing. But, that's air is all recycled in the plane. So that's a very high risk. People that do travel a lot, they can get the influenza. So it's important that we know who's at risk and who is at more risk than others, because influenza vaccine can be given to anybody from young adults to from 18 years old to geriatric patients. So it is not only for the elderly in reality, but the reason we put more emphasis on people over the age of 65 is because there's a high mortality rate on people above the age of 65. Now, when we look at the at influenza as a whole, 5 to 20% of Americans becomes ill with influenza every year. 5 to 20%. If we translate that into number, we're talking about some 15 to 60 million cases a year. That's a lot of cases. And usually, if we don't get immunized, we will recuperate from that. But there is a subgroup that we're going to talk about later that they will have a higher tendency of getting hospitalized or even dying from a simple influenza case.
Well, before you go on with that, there are people, I always do that, and I go, in fact, I'd like to, I think maybe I can get down there today because I know you're open on Saturday.
Yeah.
That's why. It's very good for a lot of us who it makes it easier. And I know when they did it last time, I was waiting for him to do it. He said he already did it. I mean, it's very fast. There was no pain. There was nothing.
Yeah, we use a small needle. We tried, and that's one of the beauty compared to going to a pharmacy or anything like that. We know the patient already. I've seen some cases of people that go to a pharmacy, they come back with a huge hematoma. They say, well, did you tell them you're taking aspirin or Coumadin? Oh, no, they didn't ask me that. They just gave me the injection. So,
that's the point.
Go to your doctor and get it done.
Mm-hmm.
When it comes to influenza, about 3,000 to almost 50,000 people die every year.
No. I don't know that.
In the United States, in our country, right here.
And that's from the flu?
Just from the flu.
And why is that? What is the flu? Tell us.
Well, the flu is a viral infection. If you remember the H1N1 epidemic that we had, it's a viral infection. And usually viral infection, we can fight it just with our immune system. The flu and the pneumonia, they both go hand in hand. So a person can get the flu, and then bacteria that is normally in your mouth or your sinuses can overgrow, and that can give you pneumonia. Or somebody can have an infection and they cough, and the particles that go up in the air, you inhale those particles, and that will give you the pneumonia. So, but when you get the flu, your body will try to fight it. And the problem with the flu is that every year the virus changes its composition. So the body,
I know I hear that, but what does that
cannot,
mean? What does that really mean?
What that means is that the virus goes through evolution, and every year is a different set of virus that will come in that will have a tendency to affect. And the CDC, what they try to do every year is try to identify, the top 23, 25 strengths that will be affecting people, so that we can prevent the patient from dying from this condition. So this is why you have to get immunized every year, and this is why for people that live locally, get immunized now before the snowbirds start coming down and all that. That's why when they come down and they get immunized, then we're going to increase the chance of reaching our goal, what we call the Healthy People 2020.
Healthy People 2020.
Yeah, for the year 2020, what we are trying to do as a nation is if we can reach and vaccinate 90% of the population over the age of 65, all of the 90% at least of the high-risk adults between the age 18 to 64, and all 90% of the residents of long-term care, and 90% of the healthcare professionals. If we grab that group and hit 90% of that, we can prevent any epidemic and prevent death from this condition that is very common, that we see it every year. And then 80% of all others in the community. So if we can reach that, then we wouldn't have a problem.
Okay. Well, I do have a question about this. I have friends who are in their 50s, and they complain, oh, well, I'm not taking it. You take those shots, you're going to get the flu. And, of course, I say, well, I do it. I don't get the flu. Dr. Mencia does it. His family does it. What do we tell those people who have this problem?
Yeah, you and I are obliged to do it because of, you and I, we are always in the healthcare field. We're always out there working, with people, and we can be a carrier. We can be transmitting from one infected person to a non-infected person. So, yes, we should be vaccinated. Everybody else out there, if you want to help the United States reach the Healthy People 2020, then yes, you want to get vaccinated, because it's just going to stop the chances of hitting another pandemic like we did with the H1N1.
I remember they ran out of
exactly
flu,
and there was
medication.
They couldn't get the there was no medication. So imagine we're talking about 15 to 60 million cases right now every year without a pandemic. This is the norm right here, and we are willing to accept that as a norm in our country. And this is we're supposed to be a developed country.
I know, and I should do something on this. I think it's very important. I didn't realize it was that high even now and that's not even the epidemic.
Well, if you look, this is what we want to reach, that 90%. If we go back and you say, okay, healthcare personnel, do you know what percentage of healthcare personnel really get vaccinated?
No.
Less than 60%. So we are way below. And when
60? Less than
60.
60
Almost
people?
half of the of
the
the
one,
healthcare
you're talking about
profession.
people, doctors, and people in the
Doctor,
hospitals,
nurses, you know.
and why is that? They just lazy, or they don't know, or what?
I guess lack of knowledge, number one. As a matter of fact, this Wednesday I'm traveling to Orlando to lecture to a group of doctors about the same topic on influenza, trying to educate people so that they know that we need to start talking to the patient about vaccination. And I tell all my patients, and I have patients that say, you know, I don't want the injection. Do I have to have it? And I look at their condition and I say, well, you are an ex-smoker or you are an active smoker. You have history of pneumonia. You have history of COPD. You have diabetes. You have heart disease. So should you get vaccinated? The answer is yes. Can I force you to be vaccinated? No. Welcome to America.
Yeah. No, but I will tell you, and I'm committing right now, when I get finished with my shows today, may I come down? Do I have to have an appointment?
Absolutely. No appointment. You just come down and get your injection.
But
Absolutely.
I mean, I know that I'm special with you, but can anyone listening now, go down. Let's see how many of you are going to go and do this. Please, don't get sick. We want you to be alive to be able to listen to our radio show.
Get vaccinated now, and before the snowbirds get here, and, you know, all the infections start coming down. And that will do two things. One, it can prevent 100% from you getting sick. And number two, if you come in contact with a sick person, you might develop a few hours of flu symptom and they will disappear.
That's
which
amazing.
means your own immune system will be able to fight it without you having to lose time from work, or without you having to go through a whole week of feeling miserable, or those things. So,
I want to talk about what you just said. It seems that as one ages, when they get the pneumonia or they get the flu, it's not 3 days anymore. It's weeks.
Weeks, absolutely. Because the more we let the virus linger around, the more it takes control of your immune system, and the harder to treat. And I have one of my patients she's a male person, and she took almost 2 weeks off from work because she was feeling so bad.
Yeah, I hear this all the time. So you're saying that if they are around someone, maybe it's a couple of days that they're just going to feel bad, but this definitely will deter anything.
Absolutely. You will be able to, if you do come in contact, you might feel symptoms like a few hours of symptom once you have come in contact, but your body will be able to fight it. Maybe a day of symptom, and then your body will be able to fight it.
I just have to tell everybody, people have said to me, you don't give me the phone number enough.
954 489 1345. We are located at 1608 East Commercial Boulevard.
You really want to be a disc jockey. I know.
I'm going to be one. I'm going to have Richard give me some training.
Okay, everybody, I got to do this right. 954-489-1345. But go to their website, because you'll be able to hear so many of Dr. Mencia's previous shows. It's geriatrics.tv. GERIATRICS.tv. And also, Dr.
TV like television.
Yeah, TV like television. No, that's a good point. TV, and sometimes people don't hear that well.
Mm-hmm.
But Dr. Mencia also wrote a book called Take Care of Your Kidneys, so they can take care of you. It's an extraordinarily good book. You ought to get it. You can get it on Amazon.com, or you can go down to Dr. Mencia's. But please do get your flu shots. Try to get it today. Try to get it during the week.
Drive-through.
You don't have a drive-through.
Just kidding.
Oh.
You pay.
Oh my gosh! If it isn't sex, it's a drive-through. Now he's gonna have a drive-through for sex.
You pay window number 1.
You always get me started.
Get your flu shot on window number 2, and buy the book on window number 3.
That's great. Oh my gosh! I love it. Okay. All right. Let's get back. Let's get back to the flu. I think now it's time for us to do the article on the flu for the October issue. It's
Absolutely.
making me feel
this is
that's
the
right.
Time. Yeah, this is the perfect time for that.
Okay. Now I want to ask you.
We always try to bring topics that are relevant to.
Right. We did the Olympics with the exercise. Now we're doing this. But this is the question. How does one know they have the flu and that they don't just have a cold or they feel sick?
If you get the flu, you're going to feel generalized malaise, aches and pain throughout your body, muscle aches and pain. You might feel some joint pain.
Do you get a fever?
You might get a high fever. And that's a great question, because a middle-aged person and a young adult, we have a tendency to a high fever. A person in the 80s or 90s have a tendency of having no fever. So they don't even know they are sick. Their immune system is not able to fight anything. So the viral is just replicating. And that's why so many die. So many of the geriatric patients die. They have no sense that they are sick. So if their loved one is taking care of them, they just look like they don't want to get out of bed that day. They look like they're just being lazy today. They're just going to want to stay in bed. But in reality, they're just getting sick, and then they start developing that cough, that runny nose. But then the runny nose, they say, oh, maybe it's that postnasal drip.
So they all say it's allergies.
Right, or allergy or something like that. And they just, write it off. And that's why, a high percentage of geriatric patients end up dying. Even when they go to an emergency room, the emergency room doctor will say, well, there's no fever. And white blood cell count looks normal, so probably nothing is going on. And they'll send you home. And then you go home and you die.
That is amazing.
Or
now,
you come back with a huge pneumonia, and then you die. So that's why such a high percentage of people with influenza can be devastating.
Okay, so let's say someone did not get the shot. Shame on them, but they didn't get the shot, and then they come to you because they feel sick, and you recognize that they have the flu. What would you do for them?
I hit them with everything I can.
You hit them with
everything I can. I had the lady that is a male person. She came in every day for 5 days and got antibiotic injections.
Oh.
So we did the antibiotic injection because at that point what we're doing is let's prevent pneumonia. Let's fight the flu and prevent pneumonia. So we do the antiviral treatment. We do the antibiotic to cover for the complication of the flu. We make sure the person is well hydrated.
So they should. So you're watching over them to prevent them to go to the hospital and die.
Every day they come by the office, spend 10 minutes with me. I look at them, check them out, do some blood tests. And, we do have the lab right in-house. So when we do the blood test, I get the result the same day. I don't have to wait, send it to Quest, come back. No, I get my result right away. I don't have to go with the outside lab unless it's an insurance that demand that. If it's an insurance that allow me to do it in my office, I do it in my office.
Well, and I don't have it now because I don't have cats and all, but I have been an asthmatic for years, but I'm very good now. I'm careful, but as soon as I get something, it goes right into my chest. I know the wheezing, so I am very careful about doing this. I'm going to be there this afternoon.
Absolutely,
I'm coming.
Yeah. And,
I swear to you.
When we look at our, my specialty, which is geriatric medicine and internal medicine. As an internist, I see the younger adult, and some teenager. Yesterday, I got to see a teenager that had
break it up for you.
Yeah. So when you look at the geriatric patient, they constitute about 15% of the U.S. population. And 15% and 63% of that population, end up hospitalized because of influenza-related illness. Mm-hmm. And 90%, like we say, the older you are, the higher the risk. But more than 90% of influenza-related death are in the geriatric population. Only 10% are young adults between the age of 18 and 64.
So babies and young children should not have flu shots? I thought I heard that they should, but
they should. No, they should. But who have it? When you look at the young adults, the adult population, as an internist, that's what we do. We look at young adults. And then as a geriatrician, I look at people over the age of 65. So when you look at the young adult represent 31% of the total economic burden of influenza. And 35 million cases are young adults every year. And about 10,000 deaths are attributed to young adults with influenza. 10,000 every year.
That's so silly. All right, so now does Medicare pay for the shot?
Medicare and most carrier will pay for the injection. So if you go to, if you don't go to your doctor and you want to go to a pharmacy, I don't know why you're going to do that. But
no, we're not going to do that.
It's like segmenting your care.
No, I agree with you. Let's go to the doctor to do that.
Go to your doctor, get your influenza
Let's
shot.
go to Dr. Mencia. That's mine.
Come to me.
Yeah, come to Dr. Mencia.
And get your injection.
But so... Okay, so you're saying, and it's only one. They only get one. They don't have to get more, right?
They don't have
one
to
for
get
the
more
time.
Because
once a year.
Every injection usually will cover for that winter.
Okay.
So if you get the injection now, you are covered for this winter coming.
It's October, everybody. Before
Oktoberfest.
Oktoberfest, right? And before bring beer, but before everybody comes down, that's what we want to do, right? Because that's when you need the protection.
Right. And what happened in 2009, the influenza H1N1 pandemic. As a society, we don't want to go through that again. We need to avoid that stuff.
Yeah, I remember. It's funny. I knew some doctors, and they were hoarding the serum because they were afraid people were going to run out.
Yeah, exactly.
And so we don't want to do that. But I just spoke to someone. Actually, this is interesting. They wanted to be on the radio show. They came from. It was the person, a woman who's running the Palm Beach County Health Department, and she wanted to get on for this very thing on the flu.
Mm-hmm,
and I didn't know you were going to do this, and I didn't have the space or time, but I'm so glad you're doing this.
There you go.
Because probably Broward County Health Department and the Miami-Dade, they probably all want people to get it. Now, there for people who don't have any money or young people, whatever, they have to go to their, stand in line and wait and go do that. But
and if we have a pandemic, in South Florida, we are at such high risk. Especially, the West Palm Beach area, Boca Raton, Broward County, because we get so many snowbirds coming to us. So when you have the same community that is unchanged, it's less likely. But when you have a lot of people coming from all over.
Yeah, but wait a minute. What about the international people coming
into
Miami-Dade?
Exactly.
And the Canadians coming down?
Exactly.
So we really have to take... So please, everybody...
If we do 90%, we do that 20-20 healthy people goal.
I like that.
We reach that 90%.
20%.
If there is a pandemic, we are going to be protected as a community.
Yeah, I had never heard of that before. That's a program. Who's doing that? The government just put that on?
The government, yeah.
That's very interesting. Well, let's talk about personal with the flu and some of your patients. I hate to ask you this. Have people died, some of your patients, from this? I'm
very grateful to God that I practice medicine the way I do. I do a lot of preventive care. I have seen cases in nursing homes that you wonder if they are getting immunized or not. Did the immunization took place or not? You don't know what's going on. But you tell them. You do
absolutely. Tell them to do it. So nursing homes then don't do it as do they have the power to say to all their residents, you have to have they don't, do they?
No.
It's all individual. Yeah. No, these people don't know what they're supposed to do, right? Exactly. But they can be encouraged.
Absolutely. And, if you have a loved one in a nursing home, you have to tell the facility that you want that person to be immunized, or tell them, let me take my loved one to the doctor to get immunized, because you want to do it sooner than later.
Right. Well, this is really important, and my staff, I have to, I do this with them, and I think one of them's going to go, but this other one says, no, I don't believe in this, and I'll tell you something, she's going to get sick, and then I'm not going to have her, and what can I do?
It's you have. It's an inactive virus that you're getting. So the influenza is not active when you get vaccinated. It's inactive. And what you're getting is like that protein that covers the viral. It's like if you have a hard-boiled egg and you take the skin off. Take the skin off, and that's why you don't have to eat the whole egg. You just look at the skin. And if you take the protein outside the viral, that's all. It's not the live viral that you are getting. So because you take only the protein, then the body, what we call the humoral and the cellular immune system, then start looking at this protein and create antibody for the future. It's like when you get the shingle injection. It's the same thing. The shingle injection, what you are doing, you're exposing the body to. You already have, when you have chickenpox, you're already well exposed. So when you get the shingle shot, what you're doing is reminding the body that, hey, if the viral is trying to come out again, put them back to rest.
So if I go and I'm coming today for my flu shot, can I have a shingle shot too? Or should not do it at the same time?
You
wait.
could, but my practice is to do one and wait, let the body react to that, and then do the other one.
Okay.
Don't rush into everything.
Right.
And the only time I do that, somebody is like traveling and they're going to be going out of the country, and they have to they're giving me a small window to work with. But if we have time, it's better, do right. One, let the body respond to that, and then do the other one. 954-489-1345.
And before we say goodbye to Dr. Mencia,
we are open on Saturday, and we have the flu shot. So please, if you want, come
you
and
may
get
see
it.
me later, because after my shows, I'm going down there. I have to tell you, there isn't another doctor who I would more highly recommend than Dr. Andy Mencia. He is my doctor, and I want everyone to go to Dr. Mencia. He's very special, and his staff's very special, and it's located there, the address is 1608 East Commercial Boulevard, and he's in Fort Lauderdale, right near Holy Cross Hospital, and his phone number, again, is 954-489-1345. Please go see him. His website is Geriatrics, GERIATRICS.TV.
Before we go. I got to remind you something.
Yes.
Remember that there are people out there that will say, I will not get the influenza vaccine because I got it once and I got sick. If you got your influenza shot and you got sick, that means that you have a great immune system. You didn't get sick. What happened is you have a robust immune system that is responding. And that's a great sign. And usually it will happen the first or second time that you get immunized. After that, then it becomes a piece of cake with frosting on top.
So I like
if
that,
you
with
did
a cherry on top.
With a little cherry on top. If you got sick, it's a good sign, people.
I've never gotten sick, though.
I never gotten sick.
No, we don't get sick. If you got sick, okay, that's the reason. Thank you, Dr. Mencia. It's always so wonderful to be with you. Okay, we're going to take a break, and we'll be right back. With wonderful people. They're actually calling in. One person's calling in from Texas. That's Charmaine. It's Michelle's in Texas, Houston, and Charmaine is in Knoxville, Tennessee. They're with the Osteoarthritis Centers of America. We'll be right back.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.